So everyone, thank you for joining us today. Jasmine Matheson is the Refugee Health Coordinator for our Washington State Department of Health, Refugee and Immigrant Health Program. Sorry, that's a mouthful. Jasmine has just really been so innovative and connective with all of our refugee resettlement groups, and really has been quite inspiring in the way that she draws community to support folks and arrivers here. So I'm sure she's open to questions, and we have some great polling questions as well.
Thanks so much, Lana. It's a very kind introduction. It's a pleasure to be at TB Echo, and I know a lot of our providers and local health jurisdictions. I see a lot of familiar faces on the line. We definitely want this presentation to be interactive, and if you have follow-up questions, please don't hesitate. With our new arrivals from Afghanistan, things have been evolving, and so I'll provide an update today, as well as some background information around just the general refugee health process. But I think if you have one takeaway from this session for our newest community members from Afghanistan, it would be to approach the screening for tuberculosis and medical management from a standpoint of curiosity and asking questions about the pathway that folks took to get here, and to look at whatever records are available and then build the process from there, because there are a variety of different pathways that folks are entering on, and we're seeing a variety of different records. And I'll go into more detail, but wanted to make that point up front. So our program at Department of Health is the Refugee and Immigrant Health Program. We are co-located in the same division with the tuberculosis program. And we approach really health from the biggest picture of health, the social determinants, the connections within community. We do a lot of partnerships across different agencies in order to support that connection and really trying to ensure health outcomes for new arrivals. So just to get everyone on the same page, definition of a refugee is listed here. And so a refugee is someone who has a well-founded fear of persecution on account of race, religion, nationality, political opinion, or membership in a particular social group. And this is the United Nations High Commission on Refugees definition. So when we talk about refugee arrivals to Washington State, this chart shows the number of arrivals over the course of the last several years. The green bars are folks who entered on a refugee visa. The blue bars are folks who entered on a special immigrant visa holder visa type. So this visa type is issued to individuals from Iraq or Afghanistan who have worked with the US government overseas, and they are eligible for humanitarian benefits in the same way as refugees after arrival. And so you can see, I'll show you actually next slide here, that we have had new arrivals coming from Afghanistan for a number of years, with the number of arrivals starting to increase in sort of 2014. And in our more recent years, arrivals from Afghanistan have been one of our larger groups. So Washington State has a very strong, engaged Afghan American community, both new arrivals as well as folks who immigrated over decades ago. So this chart just shows arrivals specific to from Afghanistan in federal fiscal year 2021, we had about 653 individuals arrive. And then this federal fiscal year, since just October 1st, we've had about 862 individuals arrive. And so in terms of refugee health screening clinics and the larger populations, and if you're starting to see folks coming in, we have definitely seen a larger number of arrivals, and we do expect to continue to welcome people to Washington State from Afghanistan. The pathway from Afghanistan was a little bit different and has continued to evolve over the course of the evacuation. But at present, there are folks on US bases around the US who are undergoing kind of their immigration, medical, their processing pieces before moving on to resettlement in their final destination states. And so we anticipate that resettlement process will continue strongly through the end of this year and into early next year by mid-February. So our refugee resettlement agencies are shown on the slide here throughout Washington State. You can see the Puget Sound region has 5 refugee resettlement agencies and typically gets about 70% of our new arrivals from across the world. But obviously, people are rejoining family, and the individuals coming from different countries and the existing community really impacts where folks go. For arrivals from Afghanistan, King County has one of our largest existing communities from Afghanistan, and particularly South King County. And so we have seen large numbers of arrivals in the King County region. On the right-hand side of this slide, our refugee health screening clinics are shown. These are the clinics around the state that see new arrivals within the first 90 days after arrival and provide a health screening examination. So that health screening examination includes the items that are listed here. Tuberculosis screening is a core part of this process. So just process-wise, for what is happening for our new arrivals from Afghanistan, that immigration medical screening, which is happening either overseas or on the US bases, and TB disease is really the focus here. And what we're seeing through Operation Allies Welcome, which is the federal response kind of broader arching name, is that it depends a little bit on the visa type as to what process folks are using. So for people who had done the special immigrant visa process, they are following the CDC technical instructions for civil surgeon in terms of the process for tuberculosis screening. For people who have humanitarian visa status, again, they're following the TIs for civil surgeons. And I will say the caveat here is it depends a little bit on the base at which somebody receives screening. So typically you would do an IGRA for all arrivals ages 2 and older, evaluation for signs, symptoms, chest x-ray sputums as indicated. For a couple of the bases, they are actually doing a chest x-ray first and then moving through the process after that. And so we're seeing some variation in records. So going back to that first point I made early on about just considering the information about pathway and what records you have available and then building what needs to happen next is really the approach that our screening clinics have been taking. And I know some of our local health jurisdiction partners that have been doing follow-up as well. Of note, typically, for folks that see a lot of refugees, you're used to getting copies of overseas immigration medical screening paperwork through the EDN system. That is not in operation at present. So what has happened is clients are being given paper copies of their screening records to bring with them to their final destinations. So moving on to the next piece of the process here, within the first 90 days after arrival, clients are supported to enroll in health insurance, complete their refugee health screening examination, and connect with primary care. Refugees, humanitarian entrants, humanitarian parolees are Medicaid eligible populations in Washington state as long as they meet the income determination, which is a facilitator to accessing care. Our health screening clinics, you already saw the list, and review of whatever records folks have at the time and potentially repeat or just building upon whatever TB screening needs to happen will occur as part of that refugee health screening examination. If there's follow-up, primary care is obviously part of that process as well. And then finally, for refugees at 12 months after arrival, they are adjusting their status. So this is to get a green card. So the civil surgeon exam is often the reference point that people have in this. It's worth noting that for refugees, there isn't any additional TB screening that happens at that time. It's just a vaccination check. For our newest arrivals who have humanitarian parolee status, that pathway is a little bit less clear. And so it may be that they have to go through the full examination, which would include TB screening again. But I think there's still additional learning to do in terms of what that pathway is really going to look like. So our refugee health screening program collects data from the health screening examinations that happen in our state, and the IGRA positivity by country of origin for arrivals who are screened between federal fiscal year 2016 and 2020 here in Washington is shown here. So we often talk about refugees and immigrants as if this is one homogeneous population, but as folks on this call are well aware, exposures are really population specific and vary significantly. So for new arrivals from Afghanistan, we see about 13% of arrivals with a positive IGRA at the time of the health screening examination. And you can see some of the other, the rates here for other countries of origin as well. So Class B TB notifications are happening in a slightly different process at this point. Again, going back to that point about records not currently being in EDN. So if somebody has Class A or Class B TB status based upon that immigration medical examination that is happening, CDC is going to be sharing or has started to share notifications with state TB programs and state refugee programs. So our DOH TB program and the Refugee Health Program have been collaborating to do LHJ notifications. We are still in the process of working out some of the logistics of how that will be happening. And finally, just some resources. There are a lot of new trainings, webinars, online courses with CME available specific to caring for new arrivals from Afghanistan, including cultural considerations. This webinar on health screening and cultural considerations features a speaker from the Afghan Health Initiative, which is based in King County, and she did a really nice job kind of working through some of those areas. We also have translated health resources on the DOH website and the DSHS page around social services resources. Specific to tuberculosis, there are a lot of health education resources that have been translated into Dari, Farsi, Pashto. And I know the most recent one that is going to be added and is being worked on is a guide for LTBI treatment and a translated resource to help support that process.